Okay. Good morning, Mr.
Morning.
Castro. My name is Laura de la Garza. I am the case manager assigned to your case today. Now, I was sent by the University Disability Services Center. What we're going to be doing today is we're going to go ahead and go over some information, and then I'm going to go ahead and ask you a series of questions just to go ahead and determine if you are eligible for the services, okay?
Sure.
Now, what I'm going to hand you right now, it's going to be the confidentiality form. This form just goes over the terms and conditions of our meetings. It basically states that whatever you do say in here is confidential. Now, if it does become harmful to you or to anyone else, I do have to let the local authorities know.
Sure, of
Okay,
course.
is that fine?
Yeah, that's fine.
Okay, what I'm going to do is I'm going to start asking you the questions. Now, if they become unclear at any time, go ahead and stop me and I'll go ahead and clarify anything that you need, okay?
Sure.
Now, my first question is, what is your disability, Mr. Castro?
I am paralyzed from the waist down, so paralysis.
Okay. Now, how did you come about getting your disability?
It was a car accident with some friends.
Okay. Now, how long ago did you have this car accident?
I want to say 6-7 months ago.
Okay, so you would say that you've had your disability about 6 or 7 months?
Yeah.
Okay. Now, since you've had your disability, have you seen a change in your actual condition? Has it gotten any worse? Has it gotten any better? Can you go ahead and elaborate on that?
Due to the circumstance of I developed symptoms of PTSD.
Okay.
But they have been improving, and with the help from a local psychologist.
Okay. Now, as far as the paralysis, are you undergoing any type of treatment or therapy regimens?
Right now in the in-house rehab hospital I'm at, we go through a series of therapies and also exercises every day
Okay.
as treatment, you know.
Okay. Now, how do you feel your disability has affected your day-to-day living?
Well, I used to play basketball for the university, but ultimately it's pretty much been downhill from there. I had to stop taking classes due to basically my situation.
Okay. Now, how would you say you get around now that you do have your disability? I'm talking about your functioning, like your mobility in that way.
Pretty much, I used to get around by bicycle
Okay.
on campus, and I didn't have a car. But now, pretty much, my mobility is extremely limited.
Okay.
I'm wheelchair bound, and that's the only way I can get around.
Okay. And are you currently seeking any help from outside sources? I know you are seeking help from the university counseling services and our services with the Disability Center.
Mm-hmm.
Is there anything else that you are getting from anywhere else?
Other than just the inpatient rehab.
Okay. Now I'm going to start asking you questions about your medical history, okay?
Sure.
Okay, now are you taking any type of medication, whether it be over the counter or actually prescribed by a physician?
Right now, it's just pretty much over the counter Tylenol just for pain.
Okay. I'm going to start asking you questions about your personal life now. If you feel uncomfortable at any time, just go ahead and feel free to stop me, okay?
Sure.
Now, are you going to work at the time?
No, currently I'm not. Well, I used to be, but now I'm not.
Okay. Now, your social life before the accident, how was that? Can you go ahead and explain to me?
It was great. I had a greater amount of friends than I do now. But,
Okay.
Really enjoyed it.
I'm going to start asking you questions about your marital status, your family, and yourself, okay? Now, what would you say your marital status is right now?
I'm not married, but I do have a girlfriend.
Okay. Now, do you live with your family? Do you live by yourself?
I live here locally.
Locally?
Yeah.
Okay. Now, do you have any children?
No.
No, you don't have any children? Okay, and say you are eligible for services and you do proceed with the rehabilitation process, do you feel that you have an adequate support group?
Definitely would be my family. As a matter of fact, they moved over to the state of Texas from out of state to help me with my situation.
Okay. Now, do you feel safe with your current situation right now?
Yes, yeah, I feel safe.
Okay. And how do you get along with your actual family members?
Very well. Like I said, through this whole incident, they've been there to support me 100% of the time.
Okay. Do you feel you have any close friends?
I have a couple of close friends that I do go to and just to talk to.
Okay. Now your social life at this moment after you acquired your disability, can you explain to me how that is?
Pretty much it's non-existent. Like I'm pretty much in bed 24 hours a day.
Okay.
and don't have contact other than Facebook.
Okay. So since you don't have a social life, like you say, how do you fill in those hours of the day?
Well, pretty much I try to stay busy. I try to stay caught up on my classes. Like I said, I'm not taking classes right now,
Mhm.
but usually with my major and trying to stay fresh on the topic at all
Okay.
times.
Okay. And do you plan on going back to school? Is that a goal that you would like?
Yeah, I mean, for like doing with the basketball team, I've had I talked to the coaches. They're letting me keep my scholarship
Okay.
and basically just work with the team.
Okay.
But yeah, exactly. I do want to go back to school. It's my
Okay.
ultimate goal.
Okay. Now, when it comes to your actual education, what's the highest you've gone in that?
Since my last semester that I finished, I left as a sophomore.
As a sophomore? Okay. And did you enjoy going to school?
Oh yeah, I love the college life.
Okay. Now, before I go on with my questions, do you have any questions for me about what I'm actually asking you, or?
No,
No?
not at all.
Okay. Now, do you have any medical type of insurance?
I do have insurance through my
You
parents.
do? Through your parents? Okay. Now, have you applied for anything other than the insurance that you have with your parents?
No.
No? Okay. And your economic status, how would you say that is?
It's fair, but pretty much I live off my parents.
Okay. And your primary source of income for you at this moment?
Like I said, I'm not employed right now, but pretty much my parents support me.
And I know you stated that you did have a bicycle to get around before your accident. Did you have a car?
No, I didn't
No?
have a car.
Okay, and the reason I ask you is because there are services provided for transportation, so if you ever do need that, we can always help you with that, okay?
Okay.
Now, what I'm going to do right now, Mr. Castro, is I'm going to go ahead and submit all your information into the system, and it's going to go ahead and let me know if you are eligible for any services. Now, if you are eligible, we can go ahead and get you situated on starting those services right away.
That'd be
Okay?
great.
It's going to take about 15 to 20 minutes. I'll go ahead and let you know once it's done, okay?
Sure. I'll be
Okay, thank you.